There's something quite unnerving about experiencing inexplicable changes in your own body, particularly when they could be early warnings of a looming stroke. In this video, we will go in depth to help you identify these symptoms up to 30 days before a potential stroke might occur. Join us in this informative video as we uncover the 11 early warning signs of a stroke. You'll be amazed at what we reveal. We get busy with life, and it's easy to overlook crucial signals our bodies send us. So, take a moment to pause, listen to your body, and learn these early signs. This is your chance to educate yourself about the warning symptoms that might appear 30 days before a stroke. Watching this video is a literal act of self-care. So take a few moments to listen quietly and understand what your body might be telling you. All right, let's dive into this video. Make sure to share this knowledge, empowering everyone to recognize these vital signs and promote a life filled with wellness and vibrance. 1. Brief loss of consciousness or fainting can be an early warning sign of a stroke because it could mean that your brain isn't getting enough blood. Strokes happen when the flow of blood to the brain is blocked or when a blood vessel in the brain leaks or bursts. Your brain needs blood to work right because blood brings oxygen and nutrients to your brain cells. If your brain doesn't get enough blood even for a short time, it can cause you to pass out or faint. This is because your brain isn't working as it should. Fainting might seem like it's not a big deal, but if it comes suddenly and without a clear reason, especially if there are other weird symptoms like weakness, trouble speaking, or numbness in your face, arm, or leg, it's important to take it seriously. It could be a sign that a stroke is happening, and getting help fast is key. Quick treatment can help a lot with recovery from a stroke. 2. Sudden difficulty swallowing, also known as dysphagia, can be an early warning sign of a stroke because it might mean that the part of your brain that controls swallowing isn't working right. Our brain controls pretty much everything we do, including swallowing. So, if a stroke is affecting the brain, you might find it suddenly hard to swallow food or drinks. It could feel like things are getting stuck in your throat. This is serious because it's not just about eating. It's a sign that a part of your brain might not be getting the blood it needs. If you or someone else starts having trouble swallowing out of the blue, especially if there are other unusual symptoms like weakness on one side of the body or trouble speaking, it's important to get medical help quickly. Quick treatment is really important when dealing with a stroke. 3. High blood pressure or hypertension is a big risk factor for strokes. Think of blood pressure as how hard your blood pushes against your artery walls as it moves around your body, pushed by your heart. Normal blood pressure is about 120/80. If it's often above 140/90, that means you have high blood pressure. Pay close attention to the numbers because it's a sign that our blood vessels, even those going to our brain, are under a lot of strain, making the heart work harder. High blood pressure and strokes are connected. High blood pressure makes blood vessel walls weaker and can speed up heart problems. It can cause tiny blood clots or plaque to break off the vessel walls and block blood going to the brain, which is extremely dangerous. The higher your blood pressure, the greater your stroke risk, so it's important to keep it under control. Why do people get high blood pressure? There are multiple reasons. It can be due to things like family history, getting older, eating an unhealthy diet, drinking alcohol, smoking, and having diabetes. But there's good news. We can do something about it. Keeping track of your blood pressure is important. Regular checkups with your doctor are a smart way to stay on top of it. Also, making changes in your life helps too, like exercising regularly, maintaining a healthy weight, and taking the time to do things you enjoy. These steps can really help lower your blood pressure. If you find this information helpful, we encourage you to show your support by liking this content, subscribing to our channel, and enabling notifications for the latest health and nutrition tips. 4. Vision problems can be an early warning sign of a stroke because they happen when the blood flow to parts of the brain that control sight gets disrupted. When a stroke is starting to happen, it can block or reduce the blood flow in these areas. This can lead to sudden vision issues like blurred vision, seeing double, or even temporarily losing sight in one or both eyes. These vision changes can be scary and confusing, but they're important signals from your body. The brain needs a constant flow of blood to work properly, and when that flow is messed up, it can affect the way you see things. So, if you suddenly have trouble with your vision for no clear reason, it's a big deal and could mean that a stroke is happening. It's a sign that you should get medical help right away to check if it's related to a stroke. 5. Numbness or weakness in your arms or legs can be an early sign of a stroke because it shows that something might not be right with the blood flow to your brain. A stroke happens when blood, which carries oxygen and nutrients your brain needs, can't reach parts of your brain. This can happen if a blood vessel gets blocked or bursts. This is why you might suddenly feel weak or numb in your arm, leg, or even your face. It's like a part of your body suddenly isn't listening to your brain's commands. This numbness or weakness often happens just on one side of the body. It's a big warning sign that something serious like a stroke might be happening. If you or someone else experiences this sudden weakness or numbness, especially if it's on one side, it's really important to get medical help quickly. Fast treatment can make a big difference in recovering from a stroke. 6. Having trouble speaking can be an early warning sign of a stroke because it may indicate that the brain is not getting enough blood. The brain controls how we speak, so when it's not getting the blood it needs, you might start to have problems with talking. This can look like slurring your words, struggling to find the right words, or not being able to speak at all. It might feel like your mouth and brain aren't working together properly. These speaking difficulties can come on suddenly and are a big red flag that something serious, like a stroke, could be happening. It's important to get medical help right away if you or someone else starts having these kinds of speech problems. Quick action is key in dealing with a stroke. 7. Memory problems can be an early warning sign of a stroke because they might mean that your brain isn't getting the blood it needs to work properly. The brain needs blood to function, and that includes remembering things. So if there's a problem with the blood flow, you might start forgetting things or have trouble remembering new information. These memory issues can come on suddenly and be confusing. It's like your brain is having a hard time keeping track of things. If you or someone else starts having sudden memory problems, especially if it's along with other signs like trouble speaking or weakness in the body, it's important to take it seriously. These could be signs that a stroke is happening, and getting medical help quickly is really important. 8. Losing your balance or feeling unsteady can be an early warning sign of a stroke because it might mean there's a problem in the part of your brain that controls how you move. The part of the brain that helps you keep your balance can't do its job if it's not getting enough blood. This can make you feel dizzy or like you can't stand up straight. It's like your body suddenly forgets how to stay steady. If you or someone else starts losing balance suddenly, especially if it's with other weird symptoms like trouble talking or a droopy face, it's a big deal. It could be a sign that a stroke is happening, and it's really important to get help fast. Quick treatment can help a lot in recovering from a stroke. 9. Nausea and vomiting can be early warning signs of a stroke. If a part of your brain isn't getting enough blood, it can affect the functions that control your stomach. So, you might feel really sick to your stomach or start throwing up out of nowhere. It's like your brain is sending a confused message to your stomach. If you or someone else suddenly feels nauseous or starts vomiting, especially if there are other strange symptoms like a headache, trouble speaking, or numbness, it's important to take it seriously. These could be signs of a stroke, and getting medical attention quickly is key. 10. Sudden headaches can happen if the brain isn't getting enough blood. It can cause a sudden, really bad headache. This kind of headache is different from normal ones. It comes on very quickly, can be very painful, and is often described as the worst headache ever. It's like an alarm bell going off in your body, telling you that something serious is happening. If you or someone else gets a sudden severe headache, especially if it's with other strange symptoms like difficulty speaking, seeing, or moving, it's important to get medical help right away. 11. Fatigue, or feeling really tired all the time, could be an early sign of a stroke because it shows something might be wrong with how blood flows in your body and brain. When a stroke is about to happen, your brain might not be getting oxygen because the blood flow has decreased. This can make you feel extremely tired, more than just being sleepy from a long day. This kind of tiredness sticks around even after you rest. When your body tries to deal with less blood flow, it uses up a lot of energy, leading to this deep tiredness. Also, small strokes or mini-strokes called transient ischemic attacks, TIAs, can cause this fatigue. They briefly block blood flow to the brain, like a stroke but not as severe. So, if you're feeling unusually tired all the time, especially if you also have headaches, trouble talking, or numbness, it's important to take it seriously. It could be your body's way of warning you that a stroke might be coming. In summary, while there's no concrete evidence of stroke symptoms appearing months in advance, being aware of and managing risk factors like high blood pressure, smoking, and diabetes is crucial. Immediate medical attention is vital for sudden symptoms like speech difficulties, numbness, or severe headaches. We hope this video has been informative and encourages you to share it for stroke awareness and prevention. Remember to like, subscribe, and join us for more health and nutrition insights. Wishing you a healthy and vibrant life.